FASD is a lifelong condition. It doesn't go away.
There's no known safe amount of alcohol to drink in pregnancy. If women were to have that information, they could make good choices.
What I can't say is that I can predict which woman will be affected by low-level exposure and which one won't. And it is therefore not valid to say it is safe to drink at low levels.
I'm Stanley's mum. He's 9 years old. He has FASD. There were differences to him and the sort of other children his age. Not listening, not being able to sit still, just being very challenging with other children, not knowing his boundaries. When I was pregnant with Stanley, I think I found out when I was about 3 months. I always wanted to stop drinking. I just couldn't stay stopped, unfortunately.
FASD, to start with, it needs to be understood as an umbrella term. It talks about the range of outcomes that you can get in somebody who has prenatal alcohol exposure. So the mother basically drinks, the alcohol then goes into their system and affects the fetus which is developing within the womb. Now, at one end of the spectrum, you've got facial features, growth problems, problems with your neurological development and your brain. The rest of the spectrum, you may not see all the facial features. You may not have the growth problems. Sometimes that there's problems with working memory, your executive function. There's problems where they get ADHD, impulsivity, hyperactivity.
Glenn's 14 and a half now. And I've been with him since birth, really. He was in intensive care for the first 6 months. He only weighed £2 and he was full term. His lungs hadn't developed, so he had 5 holes in the heart, so he was quite poorly, like with his breathing. In time things did improve and all the better for it now. He still has a gastrostomy tube and he's still fed every 4 hours. He never walked till he was nearly 3, and he probably didn't start talking to me probably till he was about 5 or 6, and he still doesn't really communicate with other people.
It's the leading known preventable disability. If you don't drink alcohol, your baby can't be born with this condition.
You sort of tell yourself it's not going to happen to me, and then you actually realise it has happened.
If I was talking to another pregnant woman, I would tell them that no alcohol whilst pregnant. You don't have to be an alcoholic to have a child with fetal alcohol spectrum disorder.
The brain has a long period of development throughout gestation, and so therefore any effect on the brain could occur at any time during the course of pregnancy.
What we know consistently from the literature is if you drink at high levels during your pregnancy, there is a high risk of damage to the child. If you drink at low level, you're unlikely to cause harm, but you might. And those are going to be definitely to do with the cognitive damage and how they process information, not to do with the physical parameters. If you don't drink at all, there is no risk from the alcohol in pregnancy. Therefore, in terms of giving advice, we continue to suggest that no alcohol is no risk.